Blood sugar control is often linked only to food choices, yet there is a powerful tool that many people overlook, and it can change glucose levels faster than most expect. The right movement can pull sugar out of the blood within hours, support insulin function, and over time help reduce A1c in a measurable way. Research shows that certain exercises activate muscles in a way that turns them into sugar-burning engines, even without medication changes. In this video, you will learn 4 science-backed exercises that doctors and medical studies continue to support for diabetes management. These exercises are simple, practical, and suitable for real life, yet many people either misunderstand them or use them the wrong way. That is why results often feel slow or disappointing. Here, you will discover how specific movements affect blood sugar after meals, how muscles store glucose more efficiently, and how regular activity trains the body to respond better to insulin over weeks. One of the exercises shared today is rarely discussed, even though studies show it can dramatically improve insulin sensitivity when done correctly. This detail alone can change how daily numbers look on the glucose meter. Each exercise explained in this video focuses on safety, consistency, and long-term improvement rather than extreme workouts that cause burnout. You will also learn why timing, intensity, and recovery matter just as much as the exercise itself. This knowledge helps avoid common mistakes that keep A1c levels higher than expected. Stay with us until the end, because the final exercise is often ignored, yet it delivers powerful results for blood sugar control when applied correctly. It could become the missing piece in your daily routine. This channel is dedicated to sharing clear, doctor-backed guidance that helps people take control of diabetes with confidence and clarity. If you care about lowering blood sugar naturally, improving A1c, and understanding how the body truly works, you are in the right place. Welcome to our channel. Subscribe now and stay connected for more trusted, science-based diabetes tips that support better health every day. Before moving forward, it is important to set clear and realistic expectations. Exercise plays a powerful role in blood sugar management, but it is not a cure for diabetes. Its effects depend on many factors, including age, fitness level, medication use, diet, and overall health. This is why results can look different from one person to another, even when following the same routine. Some people may notice changes in blood sugar quickly, while others may see gradual improvements over time. Anyone dealing with complications such as heart disease, nerve damage, joint pain, or balance issues should speak with a healthcare provider before starting or changing an exercise routine. Medical guidance helps reduce risk and ensures the activity is appropriate for individual needs. The exercises shared in this video are widely recommended by doctors and supported by clinical research because they improve insulin sensitivity and help muscles use glucose more efficiently. These recommendations come from long-term studies that focus on safety, consistency, and sustainable results rather than extreme or short-term solutions. When exercise is applied correctly and responsibly, it becomes a reliable tool that works alongside medical care, nutrition, and daily habits to support healthier blood sugar control.
Exercise lowers blood sugar because muscles rely on glucose as a primary source of energy during movement. When the body becomes active, muscle cells begin pulling sugar directly out of the bloodstream to fuel that activity, which reduces circulating glucose levels in a very natural way. This process does not depend entirely on insulin, which is why physical movement can be effective even when insulin response is weak. After exercise, the body becomes more sensitive to insulin, allowing glucose to enter cells more easily for several hours. This improved sensitivity means less sugar remains in the blood, especially after meals. Repeated activity trains the muscles to store glucose more efficiently, reducing the constant spikes that raise average blood sugar over time. As this pattern continues day after day, the long-term marker known as A1c begins to reflect better control. Even light activity such as walking, stretching, or gentle resistance work can captate these benefits. The body responds to movement quickly, and consistent motion reinforces these effects, helping stabilize daily readings and support healthier glucose balance, without extreme effort.
Walking remains one of the most underrated forms of exercise for blood sugar control, even though it is simple, safe, and highly effective. When walking begins, large muscles in the legs start using glucose for energy, which helps lower blood sugar levels soon after movement starts. This effect becomes especially noticeable when walking is done after meals, as it helps reduce post-meal glucose spikes that contribute to higher daily readings. A short walk taken 10 to 30 minutes after eating supports better insulin sensitivity and allows glucose to move into muscle cells more efficiently. Because walking places minimal stress on the joints, it is suitable for people of different ages and fitness levels, including those who find intense workouts difficult to maintain. Regular walking encourages consistency, which plays a major role in long-term blood sugar improvement. Over time, muscles become better at storing and using glucose, reducing the workload on insulin. This steady pattern of movement supports healthier glucose balance without placing excessive strain on the body. Walking fits easily into daily routines, making it one of the most sustainable ways to support blood sugar management over the long term. Strength training plays a key role in blood sugar control because it increases muscle mass, which directly improves how the body handles glucose. Muscle tissue acts as a storage site for sugar, so having more muscle allows the body to pull glucose out of the bloodstream and keep it available for later use. This reduces the amount of sugar circulating in the blood throughout the day. As strength training becomes a regular habit, insulin begins to work more efficiently, allowing glucose to enter cells with less effort. Over time, this process supports lower average blood sugar levels and contributes to improved A1c results. Strength training does not require heavy weights or advanced equipment. It can be done using body weight movements, resistance bands, or light dumbbells, making it accessible for many people. Just 2 to 3 sessions per week can create meaningful changes when done consistently. These sessions help train muscles to respond better to glucose and reduce insulin resistance. Because the effects build gradually, strength training supports steady progress and reinforces long-term blood sugar stability through daily muscle activity. Cycling, whether done outdoors or on a stationary bike, offers a steady and joint-friendly way to support blood sugar control. This form of movement places minimal stress on the knees, hips, and ankles, making it especially suitable for people who experience joint discomfort or stiffness. As cycling begins, the heart rate rises gradually, allowing the body to burn glucose at a consistent pace without sudden strain. This steady use of sugar helps prevent sharp spikes in blood glucose and supports smoother readings throughout the day. Sustained pedaling keeps muscles active for longer periods, encouraging continuous glucose uptake from the bloodstream. Over time, this regular energy use supports weight management and reduces excess belly fat, which is closely linked to insulin resistance. Cycling can be adapted to different fitness levels by adjusting speed or resistance, making it easy to maintain as a long-term habit. Beyond glucose control, this type of activity strengthens the heart and improves circulation, which further supports metabolic health. The combination of steady movement and cardiovascular engagement makes cycling a reliable option for maintaining balanced blood sugar through consistent daily activity. Light interval training introduces short bursts of higher effort, followed by slower recovery periods, creating a powerful effect on blood sugar control in a relatively short amount of time. During these brief moments of increased effort, muscles demand energy quickly, which leads to rapid glucose uptake from the bloodstream. This sharp increase in demand helps reduce circulating sugar levels and challenges the body to use fuel more efficiently. The recovery phases allow the heart rate to settle, making the activity more manageable and controlled. This pattern improves how the body switches between using glucose and stored energy, a process known as metabolic flexibility. Because of this effect, interval-style movement can be especially helpful for reducing insulin resistance. Even sessions lasting 10 to 15 minutes can produce meaningful benefits when performed consistently. This approach may feel more intense than steady exercise, which is why it is important to begin slowly and adjust effort based on comfort and ability. When applied thoughtfully, light interval training encourages the body to adapt, improving glucose handling and energy use without requiring long workout sessions. For better A1c results, regular movement, spread across most days of the week, creates the strongest impact. The body responds best to frequent activity because glucose control improves each time muscles are used. Combining different types of movement, such as cardio-based exercise and strength-focused training, allows the body to benefit from both steady sugar use and improved muscle storage. Cardio supports daily glucose balance, while strength training builds the muscle needed for long-term control. Rather than focusing on hard or exhausting sessions, steady repetition plays a larger role in improving average blood sugar levels. Consistency allows insulin sensitivity to remain elevated throughout the week, reducing the ups and downs that affect A1c over time. Small habits such as short walks, light resistance work, or brief cycling sessions add up when practiced daily. These manageable routines are easier to maintain and reduce the risk of burnout or injury. When movement becomes a normal part of everyday life, the body adapts gradually, supporting healthier glucose handling without relying on intense workouts that are difficult to sustain. Many people struggle with blood sugar control because of a few common exercise mistakes that slow progress over time. One frequent issue is limiting physical activity to once or twice a week, which does not provide enough regular muscle use to maintain stable glucose levels. The body benefits most from repeated movement, and long gaps between sessions reduce insulin sensitivity. Another mistake is avoiding strength training, often due to fear of injury or lack of confidence, even though muscle plays a central role in glucose storage and control. Some people take the opposite approach by pushing too hard, choosing intense workouts that feel unsustainable and lead to fatigue or long breaks from activity. This pattern creates inconsistency and makes it harder for the body to adapt. Ignoring blood sugar monitoring is also common, which prevents understanding how different exercises affect glucose levels. Without tracking, it becomes difficult to adjust timing, intensity, or recovery. Awareness and steady habits help reduce these setbacks and support smoother progress in daily blood sugar management. When exercise becomes part of a regular routine, changes in blood sugar often appear in clear stages rather than all at once. In the short term, many people notice smoother post-meal readings as muscles begin using glucose more efficiently after activity. These early shifts can happen within days and help reduce sharp spikes that affect daily control. Over the following weeks, fasting glucose levels often start to improve as insulin sensitivity remains elevated from consistent movement. The body becomes more efficient at managing sugar even during rest, leading to more stable morning readings. After several months of regular activity, these repeated improvements begin to influence A1c, reflecting better average blood sugar over time. The speed and size of these changes depend on several factors working together. Consistency in exercise plays a major role, along with food choices, sleep quality, and medication use when prescribed. Progress looks different for each person, but steady habits create the conditions for lasting improvement in glucose control. Staying safe during exercise is an important part of maintaining steady blood sugar control, especially when physical activity becomes more frequent. Checking blood sugar levels before starting helps provide a clear baseline and reduces the risk of unexpected drops during movement. Measuring again after exercise offers insight into how the body responds and helps guide future sessions. Carrying a fast-acting source of carbohydrates can be useful in case blood sugar falls too quickly, particularly for those using insulin or medications that affect glucose levels. Hydration also plays a key role, as dehydration can influence blood sugar readings and increase fatigue during activity. Drinking water before, during, and after exercise supports circulation and helps muscles function efficiently. Paying attention to physical signals is equally important. Feelings of dizziness, weakness, shakiness, or sudden fatigue can indicate that blood sugar is dropping or that the body needs rest. Pausing activity when these signs appear allows the body to recover and prevents unnecessary strain. These simple precautions support safer movement and help maintain confidence while staying active as part of daily blood sugar management. Managing blood sugar does not require extreme workouts or exhausting routines that are difficult to maintain. What truly matters is choosing the right exercises and practicing them regularly in a way that fits daily life. Small steps taken consistently create meaningful change over time, allowing the body to respond, adapt, and improve how it handles glucose. Starting slow gives muscles and insulin sensitivity the chance to strengthen without added stress, while steady habits build results that last. Each walk, each strength session, and each moment of movement adds up, shaping better blood sugar control and supporting a healthier A1c in the future. If this video helped you understand how simple exercise can make a real difference, show your support by liking this video. Subscribe to our channel for more doctor-backed tips that help you take control of diabetes with confidence and clarity.